here today at Vitalskin Dermatology, and joining me now is Dr. Jeremy Youse. Thank you so much for sponsoring our segment and for having us out today.
Thanks for inviting us, and I'm glad to have you guys here.
So tell me a little bit about Vitalskin Dermatology.
Vitalskin Dermatology was started about 5 years ago. I was the founding physician. Our goal really is to provide comprehensive skin care for this community as well as others. We've grown quite a bit since starting. We started with a small clinic in Mattoon and Decatur, have grown into our large office here, sort of the mothership in Urbana. But we also have several offices in the Chicago area, in Indiana, in Kentucky, in Missouri, and so we've really sort of developed a regional presence. And our goal, take great care of patients with skin issues, whatever they may be.
Well, and speaking of skin issues, I feel like skin health is something that really should just be part of your everyday annual physical, but a lot of times people don't necessarily think about it until they see something that's unusual or things like that. Why is it important to just go for annual checks?
Yeah, it's really important. I think part of it is the preventative nature of kind of what we do. Some of these small problems can turn into much bigger problems if they go unrecognized. And as the dermatologist and Mohs surgeon, I see that in lots of various forms. People sometimes think this little pimple that's on their nose that bleeds a little bit, continues to grow, maybe partially heals up and then comes back a month or two later. They, of course, squeeze on it a little bit, try the Neosporin, do all the stuff at home. It doesn't work. Eventually they find their way in, but I think that's part of why I think doing some of this outreach to the community is so important, because the earlier we find little problems like that, in the end it's not a pimple.
Right.
It's a basal cell skin cancer or squamous cell skin cancer, which if we catch those early and get them taken care of, it's so much easier on the patient. The amount of work we have to do to treat the spot, the surgeries are smaller, the cure rates are higher, the sort of ill effects that go along with treatment of much larger lesions are really minimized or avoided completely if we catch it early. And so prevention and recognition is really the name of the game for stuff like this, especially as we get into summer and start thinking about sun exposure.
Right. And let's talk a little bit more about that, because if something is found, I know that then that's the scary time when everybody panics and what am I going to do and what are my options and things like that. But here you have sort of something for everybody, and the care is personalized and there are choices, right?
Yeah, absolutely. I think sort of my sort of approach to dermatology and skincare is really sort of based on making sure we can handle anything that kind of comes our way. I consider ourselves kind of a comprehensive, dermatology practice. We've got, PAs that are, experts in dermatology, personally trained by me and Dr. Rodriguez with lots of experience. They kind of handle the, front lines. Behind the scenes, we're there as backup when anything more complicated comes in. And so we really tackle everything from really straightforward, simple stuff like warts in childhood, acne in childhood, the bread and butter parts of dermatology, to super complex, really rare genetic skin disorders and autoimmune conditions, to common skin cancers like basal cells and squamous cells that affect millions of people across the country every year, to super rare, like aggressive forms of melanoma. And so we really sort of pride ourselves on being able to handle whatever walks through our door, and trying to keep everything in-house with our sort of local team of experts.
Yeah, and you really do have a beautiful facility here. It's very unassuming on the outside. You pull up and then it's just expansive. You have a lab right here, which I would actually like to talk with Dr. Rodriguez about some of the stuff that goes on in the lab. Is that possible?
Absolutely. We are so lucky to have Dr. Rodriguez. I think about getting a guy with his training pedigree, his smarts, and he's so humble. Right. I feel truly blessed to have him on my team, to work with him, to call him a partner. You know, and I hope we can sort of show the rest of the community how lucky we are to have someone with his, you know, level of training and expertise as a resource for us.
Awesome. Well, let's go find him and have a chat.